Hi guys and girls, my name is Dr. Sharwari and today I'm going to talk about what to do if you get pregnant before marriage. It's a situation that is being faced by a lot of girls these days, with advancing lifestyles. We are people who love to explore our lives and we are very bold about our decisions. And so we choose our partners and we choose our lifestyle, we choose the things that we want to do, which in some cases also involves having sexual encounters before marriage. Sometimes you might end up getting pregnant, having that unwanted pregnancy. It may be because you miscalculated your safe period. It might be that your contraception failed, like condom or something वो फट गया हो, या फिर हो सकता है कि आपने अनप्रोटेक्टेड सेक्स किया, उसके बाद टैबलेट ली बट वो इनफेक्टिव रही, काम नहीं किया आपके लिए, या फिर और भी कुछ रीजंस हो सकते हैं. ऑल राइट, बिकॉज ऑफ दीज रीजंस इफ़ यू एंड अप गेटिंग प्रेग्नेंट, then there are a few things that you need to know. See, the first thing is, if you are above 18 years of age, so there are two possible outcomes, that your partner might help you or might not help you. In cases where it is a casual relationship or a one night stand or a hookup kind of situation, the guy might not help you in that situation. You might feel alone. On the other hand, if you guys are in a serious relationship or committed, or even the guy has a sense of humanity in him, he might even help you with this situation. On the other hand, if you are below 18 years of age, or if you are in some sort of what you can say psychiatric condition, like in depression or mentally unstable or something like that, then it could be a bigger problem. If someone is in mental condition, if they have a mental condition, or they are below 18 years of age, they might have a bigger problem. See, what you'll see is that after unprotected sex, you might not get your periods, and from the last menstrual date that you had, even after 30 to 35 days after that, if you're not having your periods, you might think that okay, I took tablet, maybe let's wait for a few days. If you wait for 1 week and you still not getting your periods, it might mean that you might be pregnant. Okay, if you get your periods after that, well and good, maybe the tablet worked for you. In some cases it might fail. Okay, it might not work in some cases. So in that cases, what you need to do, if you're above 18 years of age, what you can do is get a urine pregnancy test kit. Get 2 of them, I would recommend, so that you don't get a false positive or false negative result. Okay, so test on both of those kits and you might have your result in 90% of the cases. Even after that, if you're still doubtful or things are not working out as you thought they would, then you need to rush to your doctor. Okay, she'll check you. She might do a ultrasound, that is sonography as we say, and then she'll tell you that okay, you're pregnant, and it's been 5 weeks, 6 weeks, things like that. Then she'll tell you about your options. Okay, if you're above 18 years of age, in order to get it terminated, only your consent is sufficient, given you're mentally stable. On the other hand, if you're below 18 years of age, the doctor is going to definitely ask for consent of your guardian or your parents or someone like that. Okay, also if someone is mentally unstable, their guardian's consent is required for such procedures. So this is the situation. In both the conditions, I would recommend that you tell your parents about it, because हाँ, माना इंडियन पेरेंट्स हैं, पहले बहुत डांटेंगे, बहुत गलत समझेंगे, घर से बाहर निकलना बंद कर देंगे, whatever. But after one point, they'll understand your point of view also, कि हाँ ठीक है, शायद गलती से हुआ होगा, शायद आपकी गलती नहीं होगी. Things happened. It was not in your control. You took precautions, but then it did not work out for you. At one point, they'll tend to understand it and then help you out. Okay, so you need to tell your parents about it, or someone elder on whom you can have that trust, with whom you have that bond of trust, that you can share everything and they'll help you out. You need to have that person with you. Okay. On the other hand, if your partner is supportive, I would recommend that make them stay with you overall during the procedure. If you're wanting to keep the baby, then it's very good. If you're not, then obviously there are some options for you, like you can get it terminated medically, as we say MTP, medical termination of pregnancy. Well, for that, till 9 weeks, it can be terminated by using some medications. On the other hand, if it is above 9 to 10 weeks, then it has to be surgically removed. I'll talk about this in detail in some other video next time, but for now we are going to continue with this unwanted pregnancy topic. Okay, so this is the thing. Now in some conditions, it's been like 2 months, probably you still think that okay, maybe I got some period situation. Girl, you need to get your head right. If you have had unprotected sex, don't console yourself that okay, it might be just because of some hormonal imbalance. You've had unprotected sex and you have not taken your emergency contraceptive, or your condom ruptured, things like that. If you have had sex during your unsafe days, that is between say 13 to your 16th day, during that span, then you need to go to doctor. If you're not getting your periods after 35 or 40 days, okay, you need to rush to your doctor. So I hope this video was helpful for you. I hope I cleared a few points. What symptoms you'll have is that you might have nausea. If you're in first 3 months, you might feel like vomiting too much, you might feel bloating, you might be having a little bit of mood swings, and of course you'll not get your periods. And if you link that to your last menstrual date, you're still not getting your periods, that is your first indication that you're not getting your menses on time. After that, you're having nausea, there's tenderness in your breasts, there are some sort of changes in your body. So you need to rush to your doctor after that. So I hope this video was helpful regarding how to check yourself, what you need to do, किससे आपको मदद लेनी चाहिए, क्या क्या आपके options होते हैं. So all this is very important to know, and I hope I cleared this. And in case, girls, if there's this that your guy is not helping out, unfortunately, and you're alone in this situation, you definitely need to have that one friend or that one person who will take a stand with you. It might be your best friend, it might be your mother, it might be your father or your brother, sister, anyone. You need to have that guardian person with you, okay? Because it's very tough to come out of this situation alone. It's not just that you're getting it terminated, but it impacts your emotions, it impacts your mind. You're very fragile at that time. So it's always better that during such time you seek some help, rather than dealing with such situation alone, okay? Don't be afraid, you'll get over it and things will work out for you. And it's not the end of the world, it's not the end of the world. There are going to be better things happening to you soon. And choose your options wisely. Just if you think that surgical procedures might not work out for you, then choose the procedure that is best suited for you. Or if you're allergic to medicines, then opt for surgical options. Okay, if you are in the less than 9 weeks that criteria, then you need to take medications. Okay, so you need to work out smartly in this situation. I know it's very tough to think practically, but then you have to keep your senses on the correct place and work according to it. So I hope you liked this video and it was informative for you. If there's anyone stuck in such situation, please share this video with them. If you liked it, please give me a thumbs up and subscribe to my channel. If you have any doubts, you can always DM me on my Instagram. Link would be mentioned below. Thank you for watching and see you all next time.